abscess is a localized concentration of pus that generally develops in response to an infection or due to the presence of a foreign body under the skin. Abscesses are generally very painful and they can cause localized swelling and inflammation and often make the skin around it very warm and red on the touch. Abscesses may develop in any part of the body but usually involve the surface of the skin. Skin abscesses are also referred to as boils, especially when they affect the deeper or subcutaneous layers of the skin. The most common sites affected by abscesses include the armpits, which is here in the axillary region, the inner thigh, which is the groin region, the rectal area, which causes perirectal abscesses, the external vaginal region, as well as along the tailbone. Tiny abscesses can also develop around the sweat glands or hair follicles and may even sometimes cause ingrown hairs to develop or acne pits. Abscesses can also affect our organ systems, including the brain, the kidneys, the liver, the lungs, the breast, the tonsils, the knees, and even our feet. The actual symptoms of the abscess may vary depending on the size of it, the location of it, as well as the stage that it's currently in. But the general signs and symptoms of abscesses include a painful compressible mass that is warm, tender, and pinkish red in color. Many abscesses may also have a point or a little dot on the top where it can actually spontaneously begin to drain or empty out. The abscess may become so large and actually grow deeper into the tissue levels, where it may in fact reach the bloodstream and may even cause septicemia in an individual. In these cases, as the infection spreads, the individual will begin to develop nausea and vomiting, a fever, chills, increasing skin pain and tenderness, as well as increased redness. As mentioned before, some skin abscesses will actually rupture and drain on their own, and this is called spontaneous drainage. And this is great because when it does so, the pus from the cavity is actually released and the body has a better chance of healing on its own. But in many cases, skin abscesses don't actually rupture on their own, and they will require medical treatment by a healthcare provider. In these cases, incision and drainage must be done. A doctor may also prescribe pain medication depending on the size and the extent of the abscess, and generally antibiotics will not be required unless the abscess is associated with a surrounding skin infection. Make sure to like, follow, and subscribe to our YouTube channel for more videos.